doses of vaccine or Covishield taken, does that mean you are now vaccinated, recognized across the world as somebody overseas? Hello everyone, I am Aradhana. That's the answer that I'm speaking with my family here. I am joined by Guru, who will tell you about how he has to change his plans. I'm joined by a doctor who will tell you what does it mean to mix vaccines as some countries are now proposing. And Sanjay Duri, of course, our editor Europe, who is also with us. And the reason we are debating it is because the United Kingdom has come out with a policy which has been called racist by politicians here in India. Jaram Ramesh has called out the policy of treating vaccinated Indians as unvaccinated, forcing them into a Indian quarantine as racism. Shashi Tharoor has cancelled his book launch related functions in the United Kingdom, protesting against what the United Kingdom has decided. So what exactly is this controversy? Sanjay, if you can help us understand why exactly is the UK treating Indian vaccine holders unvaccinated? It's Covishield also, which is in this trap. Covishield, which was ultimately in alliance with AstraZeneca.
Well, this is the problem. In terms of travel, what is of note is that the UK has announced new rules that will take effect from the 4th of October. For Indians traveling to the Britain, there is no change from the present. And the fact that there is no change is the problem. The UK has published a list of countries from which it will accept Oxford AstraZeneca vaccine, but that list very pointedly does not include India. So the UK government is making a distinction between Oxford AstraZeneca being administered from a list of select approved countries and the same vaccine once it is produced and administered in India. There is a serious question why the UK is doing this. In fact, the UK is doing quite the opposite of what it had done earlier. The UK had placed an order for 10 million doses of Covishield. It received 5 million, began to administer them, and complained that it is not getting enough and the balance 5 million on time. So now it has moved from that to not recognizing it at all. The reason, perhaps, and no reason has been announced, and we are waiting eagerly for a reason. In fact, we're waiting more eagerly for a change to the decision. But the Covishield not being recognized in the EU and many other countries means that British people who've been given that vaccine have not been able to travel there, and there has been a good deal of mix-up and uncomfortable overlaps there. But that still does not quite explain it. But the fact is that the UK government is making a distinction between approving the same vaccine from a whole set of countries and leaving India out, and that's the heart of the problem.
Right, and India has threatened to reciprocate in the same manner. What India is threatening is that if UK is going to force vaccinated Indians into 10 days of paid quarantine, if UK travelers come to India, we will do the same. The matter has also been taken up at the level of the external affairs ministers of the two countries. We are definitely hoping this will be resolved. But is UK the only country where Indians are facing this problem? Saksham Singh, the student who was supposed to start his classes in Canada, had to delay his plan. Saksham, what vaccine have you taken and how does that really impact? How does that you have to change your plans because the vaccine?
Yeah. So, ma'am, I have last year enrolled in LLM in Montreal State University in Canada. So, like initially, like I was given that it will be like just 4 months online, then it won't be like further on, and the restrictions will be easy. On that condition, I took the admission and spent 15 lakh rupees. Like it's a big amount. Like for it, I was going there to attain foreign experience, like a learning experience. So, but unfortunately, like it was linger on, and then they putting more like this condition. Then you have to be fully vaccinated, and then they again put this condition that it should be Covishield, not Covaxin. So unfortunately, my parents, they also had planned to go with me because of the conditions were not good here in Delhi. I'm from Delhi, so they had one shot of Covaxin. Yeah, and that's again this created problem, because I can't leave them as well, because we have half a family living in Toronto. So this created problem, and now after every 1 month or two we get a notification that they change that now you have to quarantine for 3 days in the government hotel, the government authorized place in Canada, and then 14 days more. So like it will cost more than lakh, unnecessary burden on us. But apart from that, what I noticed is,
Yes, go ahead, go ahead.
yeah, I can't hear you,
What I was asking
ma'am.
you is, if you have taken Covaxin, your university and the Canadian administration is not recognizing Covaxin, and they're forcing you to take a vaccine which they have recognized, right?
They are not forcing you. They are saying that it's not in the list, what they have prescribed. It's not they are cooperative, but they can't do anything because they do what the authorities they give them guideline. They are just
Right.
institution like the university, but ultimately they have to follow the government guideline. That's what I'm saying. Yeah.
Dr. Gupta, I have in fact heard similar stories from US as well. Colleagues have experienced this. People have written to me on Twitter as well, saying that children who were going to attend classes in US who had taken 2 doses of Covaxin are now being forced to take a booster dose of Pfizer or Moderna because those are the only vaccines recognized. Now, scientifically speaking, do we know what happens to the body if you have taken 2 doses of vaccine and are now being forced to take a dose of either of these two, Pfizer or Moderna?
Yeah, Arnima, before coming to your point, I will add Saksham's story also. One of my doctor colleague had two sons, they are twins, and they got admission in one of the reputed University of Canada. And similar thing happened with them. They children were both vaccinated with the Covaxin, and because Covaxin was not approved by Canada and Canadian government, therefore even initially there was so much other problems also, like flights was not there, not direct flights were not available. They have to go with the connected flights. Even during like change over the flights also in that country also they have to go for the again RT-PCR test. Even our RT-PCR test is not recognized by other countries also. Including how much it is painful if somebody he is getting a RT-PCR test done in India, and after 2 days again he is having a halt in a different country, again he is going for the same procedure, waiting for the same report.
My
Wrongly
friend
or
faced this
unknowingly,
problem.
yeah, sometimes it can be positive also, false positive also. Then how they will survive there, how will they pay money in the hotel, and when there were so many difficult, and I know that how painful was for them, and we were all supporting them. Finally they got the ticket, and finally they reached Canada also, but they have to stay for 14 days in a hotel for quarantine, and they have to spend around 2.5 3 lakhs for their stay. And everybody cannot afford it. Even they were had some friends and relatives, those who were helped in the fooding and all lodging, all etc. But definitely this was the one problem. Second problem, like as you told, there are in US and some universities they are asking them to get vaccinated with the Moderna or this Johnson and Johnson vaccine or Pfizer vaccine after getting 2 doses of Covaxin or Covishield. That is absolutely correct in current scenario. Even we are not asking right now for any booster dose because we didn't have sufficient data when we can advise for the booster dose. Maybe it will require at least 9 months to minimum 9 months, maximum 1 year to 2 years. Maybe at least 1 year or 2 years we will get, and we will even advise this booster dose after having data. Currently, I will tell you within 2 days we have some we have gone through some studies, and they are recommending maybe we will require after 2 years, or maybe it will not require. Even within 3 month interval, if you are giving 3 doses of vaccine, it means you are inoculating antigen in the body. Antigen is a foreign body. Whenever we are inoculating anything in our body, it looks like the antigen, or it's known as foreign body, and it activates some reaction inside the body, and they produce the antibody. And the vaccines, they are having all three different platforms like Covaxin, Covishield, Moderna, Johnson and Johnson, or Pfizer. They are having all different platforms. Some are nucleic acid vaccines like Moderna and Pfizer RNA vaccines. Some are like this are Baron inactivated virus vaccine. Some are their like this protein based vaccines. It means they can have some different side effects. They are not required And if they are not required, definitely we should not advise, we should not recommend anywhere in the world for the booster shot of different company until and unless it is proved that it is required or it is beneficial. That's my point.
Right, right. So the parents whose kids have gone to US, they are worried for precisely this reason, that they're not very sure that their children to attend classes in American universities are going ahead and complying with the requirement. But we just don't have enough research. We just don't have enough data to know what impact this kind of mixing of vaccines is going to have on them.
I
But
think
Sanjay, coming back to the yes, yes, Dr. Gupta.
I think WHO should be more proactive on this part. In India, we have inoculated more than 75 million people, I mean around 75 crore people. There is so much data available here. Why WHO is not proactive for India? They are proactive for US, Europe, Canada, I mean, all developed countries. Whenever they have done, FDA will apply and they will get approval. Why our Indian government and Indian ICMR or Indian Drug Control Authority, they are applying for WHO. They have Covaxin is given to so many people, and that is one of the
Dr. Gupta, can
best
you just
vaccine available.
clarify? Can you just clarify, Dr. Gupta, is there a problem with the Covaxin data? I mean, its efficacy data. Is that
No,
why
no,
countries
it was
worldwide
problem
are taking time to recognize?
in the month of January only when there was insufficient data. But now we are in month of September and millions of doses has been given by Covaxins also. And we are asking for only emergency authorization of the vaccine, not for the full authorization. It means
Right,
there is something delay by the WHO also. And I think most probably they are having a meeting on 6th of October next month.
right.
And most probably Covaxin will get also approval. Next month, PM Modi is visiting US. How he will get approval? He is having two
And
shots of
I
Covaxin.
think, Sanjay, correct me if I'm wrong. Diplomatic exemption is there for heads of state and prime
But
minister of the
exemption is
state.
there, but I think policy will be similar for everybody.
Yes, Dr. Gupta, Sanjay, if you can just clarify this. As heads of state who are heading to New York and Washington, I think they will have exemption, but this is it seems more political than scientific. The objection that the West has to Indian vaccines.
Well, there are two separate issues relating to these two vaccines. With Covaxin, as Dr. Gupta has been telling us, I mean, this vaccine has been administered safely and successfully all through the year. And there is a very clear case, there is very clear and convincing data, and it deserves to be recognized. With Covishield, the issue is different. The Covishield is another name for Oxford AstraZeneca. So when the UK government says that, and the EU says, the two, despite Brexit, are now talking the same language, when they say they will in effect not recognize Covishield because it is manufactured in India, they are pointing to, therefore, some issue with the manufacture of the same vaccine in India that they find unacceptable. They have not spelt out what that is. And so these are slightly different issues with these two vaccines. And in both cases, for different reasons, there is a very clear reason and clear case for both to be recognized in the EU, in the US, and worldwide.
United States of America definitely has said November onwards there could be clearance for vaccinated people to travel to US. We'll just have to see once again what are those vaccines which are recognized by US. But the big takeaway after speaking to my panel seems to be that there is a scientific case for allowing Covaxin and Covishield international recognition. WHO must step in. Second thing, diplomatically, I think Indian government is already taking it up with the EU, with the US and with the UK as well, trying to ensure that this discrimination ends. Like we have been showing you politically, this has been called out, it's been called as racism. And the students on my panel today told you how their plans are just going haywire, plans of studying abroad, how it has become costlier. So there are issues related to what is being called vaccine racism. If you have any views, do share with us on our social media handles. Thank you to all three of you, Saksham, Dr. Gupta, Sanjay. Thank you so much for joining us and sharing your views.
Thank you so much.